The exercise for the knee/thigh rehab is Bosu ball squats. So this is part of the strengthening and proprioception phase of rehab. And the exercise prescription that I'd recommend is 2 sets of 6 reps. That way they're challenged to get off the ball and back on it. And they don't get to just like stay on it all the time. They have to like reset. But I've seen a lot of people do 1 set of 8 to 10. Um, so this exercise can be extremely difficult and people will often shake. So just give them time to get used to it. We're not afraid of the shake, but um, yeah, just give them a chance to get used to it. And as you can tell, I'm shaking, but for the most part, doing the exercise that as it should be done. So to progress this movement, you would make it weighted. So give them dumbbells, kettlebells, you could also do it banded. That way they're like driving their knees outward and working on not collapsing into that valgus position. You can also increase the sets and reps. And with that being said, to regress it, you would just decrease weight. You would also go from like a flat ground squat, then go up to Eric's, and then keep going upwards to reach Bosu comfortably and successfully. You could also do a Bosu ball with support so they can like lean on that table, that the patient table that I'm beside. Um, you can also do like mini squats, so like partial squats that don't reach full depth until they're just more comfortable with that movement. And then they can go to a full depth squat. And then just decrease sets and reps. So you want to discontinue the use when pain is greater than a 3 out of 10, if numbness and tingling occurs, if the patient cannot complete the exercise and begins to fall because then like they could be harming themselves and that's not what we're trying to do here. Or if they're moving onto like a different rehab phase and you would want to progress them when exercise can be successfully performed with the current weight, sets, and reps, and no discomfort or pain occurs during the exercise. So we want to be careful of improper form and watch to see if the patient favors one side. We also want to make sure they're doing this movement slow and controlled, so like working on the eccentric movement as well. So the correct form for this would be to stand on the Bosu ball with feet hip width, shoulder width apart. Engage the core and keep the chest up and bend at the knees and lower the hips back and down into a squat position, going as deep as the patient can go comfortably without provoking that pain. And then to come back up, they press through their feet and heel to return back to that starting position. Thank you.